Hello, my name is Ajane Folks Carter,
My name is Ellen Amanita.
And my name is Andrea Ducas.
and today we're going to be discussing our job analysis. We did a cashier slash stalker at a grocery store. Um, and then our case study is going to be about Sarah. So today we are going to talk about, we're going to give an introduction, and then we're going to talk about the case study, and then we're going to talk about the analysis and assessments and other things. So Dequervain's tenosynovitis is a condition that causes the tendons of the thumb to be irritated and inflamed. It is caused whenever there's a repetitive motion of the thumb and the wrist. A lot of the symptoms are mainly the pain in around the base of the thumb, swelling, and a lot of tenderness. Whenever you go to a doctor to confirm that you have Dequervain's, a doctor will perform the Finkelstein test. And so basically the thumb is going to go across the palm. And then to do it, you'll just flick the wrist and the owner direction. The ICD-10 code is M65.4. And then this also refers to radiostyloid tenosynovitis, and that is the medical term for Dequervain's.
All right. And
So for the case study, Sarah is a 32-year-old woman who works as a cashier and stalker in her town's grocery store. Her duties involve scanning, bagging, lifting groceries, and stocking shelves. Most recently, Sarah has been experiencing pain and swelling at the base of her thumb. Over time, it would worsen to the point where it was hard for her to perform her job duties. Concerned about these problems, Sarah described her symptoms to a friend who suggested she may be suffering from De Quervain's tenosynovitis. Following a visit with her doctor, the diagnosis was confirmed and surgery was recommended to fix the issue. After surgery, Sarah was referred to an occupational therapist to help her recover and return to work. The occupational therapist designed a custom splint for Sarah to wear as part of her treatment. An occupational therapist conducted a workplace assessment to note any recommendations. One of the recommendations she was given was to adjust the height of her workstation to allow her wrist to be in a neutral position. This change, along others, allowed Sarah to successfully return to work.
So at Sarah's job, some of the key tasks that were contributing to her Dequervain's was a lot of scanning, lifting heavy bags, and repetitive grasping, and then also leaning over. Some of the workstation issues was she had a very small workspace, making it difficult to bag her groceries. The counter height was also very small and caused the worker to bend down a lot, which made it bad for her posture. Um, the other thing was her wrist posture wasn't the best because she was scanning at a lower height. And then the cash register position wasn't well either. And then one of the risk factors of Dequervain's is a lot of physical work.
all right. And some of the recommendations that we had after the ergonomics workplace assessment. So for example, when it comes to work organization, just having a workstation or a front-facing check stand instead of something that's a bit further to reduce twisting or to like minimize reaching. We encourage there to be like more of a rotation between cashiering and stocking, something of more of a balance to reduce all the repetitive hand motions, which leads to the tendon strain. Just enforcing more breaks possibly to reduce the strain of prolonged twisting or gripping, and providing an adjustable check stand height So in the normal height should be about like 36 inches, but from 36 to 38 inches to accommodate the cashier's height. Some of the other things that we have is making sure the cash drawer is at a regular distance, making sure that everything is in visual display, everything that they will need, such as like the keyboard mounting, all of that, just to reduce a lot of the like strain on the hands. Right, let's see. Okay, and some other things, kind of like AJ mentioned earlier, work posture. So making sure that everything that is needed regularly is within reach, making sure that the cash register is below eye level to reduce neck strain, like below eye level at a regular distance. We did recommend that we know that it's not typical in this position, but there are some grocery stores that do allow cashiers to sit down during their shifts sometimes, and we think that that would be better, just so that they're not always reaching for things, or they're able to sit down. It helps with posture, and also helps them keep that neutral wrist position. Some of the other things would be making sure that everyone has training on the proper ergonomic techniques, whether that's lifting, whether that's regular hand motions, just making sure that everyone understands what is considered safety protocol. All right. And Eleanor, this slide is for you.
So things that the client could benefit from. So she could benefit from holding the item close to her body within the safety zone. Keep the body facing forward and the item in front of you. Keep your back straight. Use your legs to do the lifting and use your feet to turn your whole body if you have to turn. And some depictions to the right show what this would look like. So demonstrating the proper lifting technique and holding techniques.
All right, and we have the workstation design, just some recommendations like we mentioned earlier. As you can see in this picture, we have the best work zone and the preferred work zone, and we recommend that she stays within her preferred safety zone and reach only as far forward as the wrist, or slightly bended, and as wide as the shoulders. So as you can see in that picture, they're demonstrating it. So you can see how close things should be. Like we mentioned earlier, everything should be within close distance, everything that you need, instead of like that extra effort, which causes the strain in the hand. If needed, use heavy lifting carts. If when it comes to stocking, if something is too heavy, instead of you doing it yourself, make sure there's somebody else there to help you, or using items such as heavy lifting carts if needed. So just making sure you have the resources you need or the items you need in case you're not able to do it yourself. And next we have just some recommendations. So for example, grasping items using one or two-handed grip instead of lifting it with one hand. And this helps you when you're using, like when you're trying to carry bulk items, instead of using one hand, like I mentioned, you can grasp it heavy or bulky items with both hands. Scanning items, when you're scanning, use power glide to move the items through the scan with a power grip. So instead of something that's like weaker, like using one hand, you're able to just make sure you're grasping things better with that power grip. And as you begin sliding the item with one hand, you take it to the other hand. That way there's more of a balance. All right, and making sure you're keeping your wrist relatively straight, no bending of the wrist. Right, next, to lift smaller items, which we know cashiers do all the time, making sure you're grabbing at the top of the top and the bottom using that power grip, as you can see in the picture. And we, like I mentioned earlier, avoid lifting with one hand. Lastly, when you're keying in data into the like the check-in stands, you make sure that you're keeping your wrist relatively straight and pressing the keys lightly. When you're weighing items, use both hands equally and slide them onto the scale. When you're bagging items, make sure the weight is adjusted on the bag well so that you can stand up straight and to distribute the bags evenly. And lastly, handing the bags to the customer, like I mentioned earlier, you want to make sure you have that power grip and keep that bag close to your body. So those are some of the recommendations that we have.
And these are pictures that I have taken. So for the first person, there is the lady that is holding the bags, and she's not using the proper grip, the power grip that not Eleanor, Andrea was just referring to. On the second picture where the cashier is scanning the objects, she is not using one of the techniques that were mentioned before in the slide before. She is doing more work and her wrists are not in a neutral position. And she did not do the power slide. And that would greatly affect her and make her more prone to getting deeper veins. The last person that we see, she is keying the object. So she seems like she's in a more neutral position when she's keying in objects. And then the way her posture is, it could be something that um, affects her and her like working. The occupational therapy impact for a person dealing with deeper veins is they can provide workplace accommodations and assess the ergonomics. So one suggestion is increasing the height of the register to allow the wrist to be in a neutral position, suggesting that shoes and mats that will not put more strain on the body. Another thing that an occupational therapist can suggest is therapeutic exercises. So, giving the cashier stretching exercises to increase her flexibility in the wrist and the hand, and then also suggesting that using ice or heat to help with mobility or swelling. And then also educating the person and talking about ways to decrease stress on the hands could also help them reduce the chance of getting deeper veins.
So thank you for listening. And then next we have our references. Thank you.
Thank you.